PK with Chartis Group. It is really great to have you on this program because you have visibility into a lot of health systems. How many health systems?
So currently I'm working with about 8.
Okay.
But, on average, we work with, on the rev cycle side at least, over 44 clients this year.
So you really have great visibility into what's going on in the space of innovation around revenue cycle.
Definitely.
So my sense was, as we got through the pandemic, we had this opportunity to kind of learn we can go faster than we thought we could.
Yep.
But maybe over the months that have ensued since then, sort of returning maybe a little bit back to normal. What's your view of that? How's that looking from your perspective?
Yeah, I think it's the competing challenges and priorities, right? So I think there was, when things were slower, the organizations that had more capital available to them or had the time and capacity, they were willing to make those investments and actually say, this is the time we double down, right? Telehealth took off. You saw more in the automation space, and you saw the desire to invest. And then I think as we went through like vaccine deployment and other things, resources got shifted, and so it was a challenge. And so now everyone's kind of coming back and saying, okay, are we back to normal a bit, or our new normal?
Sure.
And you're seeing that the level of investment's still there, but I think there's a little bit of apprehension, right? Because it's like margins are down.
Yeah.
Labor's challenging.
Man.
And so the time and investment, right, is even greater now. And so you're looking and saying, okay, we have to weigh it with a higher degree of, variables of like, what is it going to take from a dollar standpoint, people, the change management components. So I think that's where you're seeing a little bit of it's slowing down. Mm-hmm. But I still think those organizations that kind of put their foot on the gas during that time, they're actually really, reaping some of those benefits. And I think the others are saying, okay, how do we get caught up now?
All right, so some of the current challenges, you mentioned we're in a margin crunch, dire margin crunch, and definitely labor shortage is a big issue. Some of that driven by disengagement generally, but also burnout, other things, just difficulty finding and staffing. I also understand that a lot of the revenue cycle staff is actually being drawn to third-party revenue cycle outsourced organizations rather than at the health systems themselves.
Yep.
What are the key areas of innovation that these health systems are focusing on to deal with those challenges?
So I think we've talked a lot about automation as an industry for the last 5-10 years.
Yep.
I think there's been a lot of, there's been successes, there's been some failures.
Yeah.
And so I think there's still that reticence, but it's the right approach, right?
Yes.
And automation, how we view it oftentimes, can be third-party bots or, companies you work with. You can build your own. Optimizing your current technology you have, so whether you have Epic or Cerner or one of those platforms, making sure you optimize the workflow in there. But I think it's looking at all of that. That's how you're trying to solve for some of it. I think the biggest challenge that continues to exist is how you articulate that within your organization of how it's going to solve the problem, and then for your existing staff, making them feel secure that this is additive to what they're doing, right? It's not intended to replace them. You're actually trying to fill gaps, fill voids.
Yeah.
And be more productive as an organization without having to deal with the labor challenge that exists out in the marketplace today.
You've been in this space, you said, for about 20 years.
Yep.
Working with Chartis for 5. You've had an opportunity to kind of observe the long arc, so to speak. It seemed to me that there was about a 3 to 4 maybe year period where, I don't need to get into names now, but there was some organizations that were kind of more playing in the vapor space as far as automations go. And my sense is they kind of left a bad taste, and for a number of providers who were looking at these things and saying, you know what, forget it, we're not looking at that right now. It's not here yet, it hasn't arrived. And yet in the meantime, many automations actually did arrive. Meaningful, practical, usable automations did arrive. I'm curious, what guidance do you have for health system leaders who are trying to separate the two and maybe recover from the PTSD of that space?
Yeah, no, it's a great question. I've talked to probably a couple clients about this really recently too, which was, there's a desire to invest. They know it works. They know it's a need. They know they need to do it. There is that reticence though because of just what's happened, or even in their organization they tried on their own and they failed. Not wanting to go back through and doing it again.
Yes.
But I think it starts back to, okay, when you pick the platform or your vendor, forging that partnership, and that's what it should be. It should be a partnership, right? If you look at it as a straight client and vendor relationship, where one side's trying to quote unquote win versus the other, it never gets off the ground. I think there's that, and I think anything you do has to be tangibly measured and tracked to drive to that ROI. Because the minute you get 1 or 2 successes, it has a thing to cascade, and you can start deploying multiple automations.
Yeah, totally.
And I think it's those that have struggled to identify the right use cases, and then once they've stood something up, have struggled to track the true ROI of what they're actually getting, right? So is it actually paying off with how I thought it was going to?
Right.
And I think that's where you're seeing, a bit of hesitation. But if you can solve for that up front, and that's a lot of upfront work. Take the platforms out of it, take the companies out of it. You need to do that regardless.
So you're talking about setting goals and measuring according to those goals. What other guidance do you have for provider leadership as they look to engage vendors in this space to ensure that kind of success?
I think it's in how you negotiate the contract, right? So the procurement process needs to be pretty thorough in terms of what that's going to look like. Both parties holding each other accountable. So it's not just that it's the clients, right? It's also the vendors. Like, you need certain things from the clients. Things have to happen and occur. Both parties need to hold each other accountable for it to be successful. I think the other thing we give guidance on is setting up the right governance around it. It's too easy for it to just fall into, an IT project or a revenue cycle project, or pick your area, that type of project. It's its own entity, right? Or own type of concept and process that needs and warrants full governance and like a full program built around it. So then you can deploy it enterprise-wide versus just in one functional area.
I follow you. So now I'm super curious about this. Is it a case-by-case from one provider to the other, or is it a technology-by-technology case where you are more likely to recommend that a provider pursue an in-house development of a solution or to seek a vendor? How do you guys make the judgment call on that?
Yeah, so it depends on the use case often at times for us. So we look at it and we say, okay, what problem are you trying to solve? What's that actual use case? And then look at the internal resource availability. Do you have an automation platform you currently use? Do you have the resources to actually do it? And if you do, then weigh out go get a couple quotes and say, okay, here's who's doing it. But there have been some automations that have been deployed out there in the industry for 5, 10, 15 years, right? If that's the market leader, why would I want to try and build it on my own? Go get that. Right? If there's something that's not out there that's more custom, maybe that's where you spend your time and your investment. To say, why don't we natively develop that versus going out there and trying to work with the vendor only to work through their development process for that.
It'd be very difficult to catch up. So as I track kind of the space, it does look like increasingly what you find is deeper and deeper specialization, whether that's in analytics or it's in automation or it's in machine learning. Like, this stuff is getting highly specialized, and you have to have people with particular degrees and depth of experience, et cetera. These aren't present in these health systems. Are you seeing that it's increasingly necessary for these providers to form partnerships with vendors, or are they finding ways to backfill those gaps?
So I think it's both right now, what we're seeing. So we're seeing some vendor provider relationships where that vendor provides it from start to finish, right? Turnkey automation solution, and that's it. We're seeing others where the providers, have their own automation platform, a handful of resources, but they know they want to put the program on steroids. So they're partnering with vendors that have the builders, right, or the bodies that can actually do it. And we've helped some of them create a strategy on how do you leverage that vendor to help you build, turn it over for your team to maintain while you build that skill set and capacity and capability within your organization. So if you do it simultaneously, you can bring your automation program up, right, and eventually decrease the need for that vendor and still reap the benefits of it. But I think what we've seen people struggle with saying, I have my people, I have my resources, we'll do it. And then there's a backlog of, I have 50 bots that I have to build, and it's going to take forever. So it's, if you're flexible and willing, there's, I think, a middle ground where you leverage a vendor in the right way.
I get you. So as you have to create those in parallel, one thing that seems to be necessary is that the health system has to have people who have a strength in innovation. So the vendors have figured this out. The vendors know how to attract innovative people. They know how to set up an environment to be innovative, right? To foster good ideas. This hasn't been a muscle that providers have been developing, and as they look to handle these innovations in-house, they need to be attracting them. We talked about the brain drain that's going away from the provider organizations. What can you tell me about how can providers attract innovative individuals, and how can they support those innovative individuals in being innovative?
So I'm actually going to take a quick turn direction from here. So I actually do think when some providers, they actually have folks that want to be innovative. They just haven't had the opportunity.
Well said,
and they haven't been given, and it starts from leadership, right? If you foster that environment, I think you give your folks an opportunity to elevate. I do think having an external person come in, like I'm bringing someone from the outside to hiring my team, helps foster some of that too. And I think it's what you're building in the ecosystem. I think you as an organization, and if you're like in revenue cycle and it's your leadership, when you're trying to get those resources, you have to talk about what that vision looks like. What are you trying to build? What are the problems we're trying to solve?
Yeah.
And where are we going?
Yeah.
If it were me and I was trying to recruit someone to come in, and I just talked about fixing today's problems,
right,
in the traditional, I want to get my AR days down, I'm working in denials, like those are all still issues, but that's not exciting per se, right? It's like, here, we're going to still do that, but we also want to innovate and do things around automation, digital patient engagement. Like, what's next? And so I think that's where you get more talent potential coming in for folks saying, I don't want to do what's always been done, but I need to do that, but I need to do more, and I want to do more. And what are you guys focusing on?
So as you mentioned, things like AR days, denial rates, that type of thing, this brings up two questions for me, actually. I'm curious if it's your feeling that we're using outdated measures to gauge the performance of revenue cycle, and if you have suggestions for other ways that we should be doing that. The second thing is, the recent news articles that I'm reading suggest that from an industry benchmark standpoint, many of these metrics are sliding backwards.
Yeah.
Like the aggregate performance of this industry on the major metrics that we're using to see how we're doing, we're getting worse.
Yep.
It's like, so what is this whole thing here for, right? Like, what are your thoughts on those issues?
So I think the challenge is some of those are like lagging indicators, right, of what you're working on.
Yes.
And some are a bit leading. I think the payer dynamics in the marketplace influences so much of that, right? Like, I'll work with some of my clients and they'll say, we don't trust the payer remittances right now because when we look at it, it's not really what happened, and so we're not going to measure it that way. Yeah. And so I think that distrust creates folks not focusing on it, but it also shows how those numbers will start to pick up. So I think the programs you put in place to address those current metrics, I think, still have to exist.
Okay.
What we've tried to work with our clients on, we try to push out there is, what are those other metrics you should be looking at? So productivity has always been one that everyone says they track, but maybe not as effectively.
Right.
Work on that. We spent some time working on like the process analytics space. So we have a remote workforce.
Yeah.
How would we know they're being effective? Like, these are some of the metrics that if you monitor some of those, so if I look at a process and I identify where the breakdowns are using analytics, and then I know who to go talk to from a training perspective or a system fix or something of that nature, it'll fix the other metrics down the road, right? So I think you have to supplement what we're currently looking at or historically have looked at with the newer data points that are available. The data exists in your systems. It's a matter of how do you get it out? Do you have the right platforms to ingest it and then view it from that perspective? And I think that's where we need to get to if we want to get out of this rut, I would call, of just the traditional KPI measurement that's out there.
I actually share your thinking on all that. So the next thing that I want to ask you about, we think about other industries, right? We talked about, I don't know if it was actually earlier, we were talking about how healthcare is considered to be somewhere between, depending on who you ask, 5 to 25 years behind other industries. What are other industries doing that healthcare hasn't been doing?
Yeah, I think one I spent a lot of time talking about is the digital patient engagement. So we talk a lot about getting the information right up front. And historically it's been, we leverage our contact centers or our service centers to call patients during the point of scheduling, pre-registration. We're trying to do all of that work. We need to put that in the hands of the patients.
We need put it in the hands of the patients,
right? So right now, if I need to fly somewhere this weekend, I have to buy a plane ticket. I go online, I enter all my information, I get there, I check in on a kiosk or on my phone.
Yes.
I don't talk to anyone.
No, right.
And I go, I have my flight, I land, it's done. We've made it so complicated that I think if we can get patients engaged a bit more, that's how we start to change it, right? Because then they're invested in what's about to happen versus the old way of doing it, which has always been, calling them, making them fill out forms and doing some of that. And I think that's a bit of a change that we need to keep doubling down on because it's in every industry. I mean, retail, fast food, you name it. I mean, the pandemic created so many more opportunities that you can order food from anywhere on any app, and it gets delivered to you.
Yeah.
We need to be better about how we think about healthcare in that same manner. Now, it's not for everyone, so you still have to have kind of a hybrid model.
Sure. No, yeah.
But for those that want it, we need to be out there pushing it.
Increasingly, there are those that want it. Yeah,
definitely.
So consumerism really has the strength to drive that forward.
Correct. Yep.
So we look at the dynamic between payer and providers.
Yep.
Really like butting heads dynamic, and ultimately the patient seems to be losing. Margins continue to erode. Yep. Some people just point at payers, some people point at providers. I know that you have insight working in partnership with providers. Why are we slipping backwards? What is happening?
I think it's, in today's market too, the labor challenges are causing a lot of it, right? I think, both sides are feeling it. Both sides are stressed, both sides are strained. think historically on the payer side, they've had the opportunity to invest a lot more in
Right.
internal resources, technology, and have taken advantage of these things like automation a lot sooner compared to provider organizations. So it feels like on the provider side, you're fighting an uphill battle.
I see.
So it's like, how do you catch up with some of it? I do think there's a way to improve relations, though, like through better use of data. Like this is one thing we always come back to. We'll work with folks on, their challenges with payers, and a lot of times it's anecdotes, right? It's like, this happened, 2 months ago, or with this one patient, this happened, versus showing facts and data tracked and trended over time, and then having a productive conversation with the other party on the payer side and saying, look, we're not trying to be unreasonable here, but this has happened in the past. Oh, by the way, we did screw up over here a few times. So you kind of are honest with it too. So it's not a one-sided conversation. It's both parties feel compelled to work together to find a resolution and a solution.
So as you are working with dozens of health systems, I'm sure there's a whole spectrum for where they may fall on how enthusiastic they are about innovation and adopting new technologies, and some are much less so. But you have identified that there's definitely opportunity for those who may not be as eager to invest in that space, that there's a lot of things that they could be investing in now. How do you get them around on that? How do you turn around their thinking? What are things that you share with them so that they go, oh, I get it, you're right, I do need to be looking at these things?
So we take a multi-pronged approach when we do that, right? So we look at, oftentimes we'll look at their data, sit with them and review it and say, okay, here's the financial opportunity that you're leaving on the table by not doing this. Then I think we hit the qualitative side. Here, you want to get to leading practice, you need to do these things. But we really orient all of those things around the patient experience. So if you can orient around the patient experience and say, doing all of these things, even if they're non-patient facing activities, you're actually going to improve your revenue cycle, the patient experience, all the things that you've been wanting to do. And you could probably track an ROI to it at that point.
That's really, that really is getting ultimately back to the basics. American healthcare has been such a mission-driven sector for so long. As you mentioned, you can draw out the numbers, you can do the quantitative, qualitative. It's when you get to patient experience that people go, oh, okay.
It's in more conversations we have now than not. I get more traction when I talk to some of these folks, when I bring that in the conversation, right? Because everyone gets it. Like, sure, we're leaving money on the table. Sure, there's more opportunity, or we could be doing things better. But then when you bring it back to the mission and just you humanize it and say, this is what's causing patients problems. Like, you can provide the best care in the world. If they have a poor financial experience with your organization, they may not come back, right? And that's crazy, right? Because you provided world-class care, great outcome, and then something happened, that we did or didn't do, and they're frustrated with the organization, and they're like, I'm not going back. That's a challenge. So those are things that are in your control that you can fix.
So not to summarize your own charter, but it seems to me Chartis is really about helping organizations navigate these challenges. And I'm sure it's highly customized guidance that you provide on a per-case basis. But if I can ask you to genericize to a degree the kind of guidance that you want to provide to American healthcare as they look at the current challenges, they're looking at these diminishing margins, they're looking at the labor shortage challenges, they have this wide field of vendors that are providing new technology. There's so much to navigate. Do you have general guidance to help American healthcare innovate?
I would say there's been so much that has been done. So you hit the nail on the head, right? With the technology and the vendor landscape that's out there. There are solutions abound. There's no shortage of solutions that we have that are out there. I think what I often stress with them is you need to go in with a plan, right? So if you don't have a plan of where to start, you're just buying or building or doing different things, and you're trying to smash them all together, and it doesn't work. You got to have a methodical plan, a well thought out plan, and then you go after and get it. And if you keep those guiding principles there, right? Like, we're trying to improve healthcare in this country. We want to serve a wider population and reach more people. And we need help to do it. We need to innovate to do it better, faster. Those solutions are out there again. I think it's a matter of taking a step back and saying, okay, well, how do I want to approach it? And then really committing to that vision. Because I think that's where, when you get into organizations of competing priorities, or there's no structured vision and strategy around that, it starts to fall by the wayside, and then you get frustration, and then there's people saying, well, we wasted money, and you get into all those conversations that you're like, okay, that's not what we need to do. But setting that stage, spending that a little extra time, you reap the benefits so much faster than if you try to do it in silos, or just smash different solutions together that don't work.
So as you've helped so many systems kind of move in that direction, I'm sure you've seen common pitfalls, common areas where people run into trouble. Can you tell me about some of the common pitfalls? Like, so if somebody's listening and going, okay, yeah, I want to move in that direction. What are some of the challenges that you can anticipate they're going to run into, and maybe can shortcut through some guidance?
So I think one of the common ones we see is when, no matter what area you're coming from, right? The clinical discipline, the financial discipline, operation, core operations.
Yeah.
When you're looking to solve your problem and your solutions, doing it in a silo without some of your peers and counterparts, I think it's mistake number one, right? Because you underestimate the impact that they have on that process that you're trying to fix or on that technology you're trying to implement.
Yeah.
It's not to say they have to be the primary stakeholders involved.
Sure.
But I think bringing them along on the journey and helping them understand your vision of what you're trying to do, it gets them thinking, right, in their world of what should I be doing? And I have that project. You should come and sit in on these meetings too, because that'll help you understand what we're trying to do. And so I think it's that communication that needs to happen, oftentimes. And appreciably so, everyone's so busy. So it's so hard for them to be, no one wants more meetings on their calendar. No one wants to sit in, more demonstrations.
Yeah.
But if you can do it in a structured way, and this is where I think leaders need to leverage their teams. Right? I think there's, if we want to grow that next generation of leaders, you need to involve them in some of these concepts and initiatives that are going on.
Yeah.
Because that's how they're going to understand why it's important to foster that growth.
We're talking about like pilots and betas and that type of thing?
I think even like if you're in a different business unit than I am, and we're tasked to work together on something, you and I fostering that relationship and communication, maybe one day we are replacing our leaders right in those roles. Now we have a good working relationship. But when we stay in our silos, you don't do that. I think it stifles, some of the innovation that could be occurring at these organizations.
And you guys help when a health system does bring in an outside party, an outside vendor, you help to create the governance, the measurements, that type of thing. That's work that you guys do. So I'm going to flip the question then. To what guidance do you have for the vendors in this space to be effective at, like putting a hand up and saying, I want to show you something, because everybody's trying to give you the 1 hour demo, et cetera. So we need a new way to have that conversation. And then once we manage to get somebody on the phone, so to speak, how do we effectively engage?
So the one thing, I talk to several vendors out there nowadays, just even on the same topic, right? Because we're privy to kind of the flip side.
Of course.
And I go back to that partnership comment I made earlier. It's so much around the partnership, and I think sometimes people say it, but they don't, and I think there are some out there that truly deliver on it. I think some folks say it, but it doesn't really pan out how it's supposed to.
Sure.
I even tell my clients that sometimes I'm like, look, you're going to get to some point where it's a negotiation right at the end. And both sides can dig their heels in and say, this is what I want, or you can just find common ground knowing you both conceded a little bit. But at the end of the day, that's not the final thing. There's so much more work to do together at that point. I think that's one big part of it. I think the second part of it is...
That's where people think the starting line is their finish line. Like, oh, wait, I'm done.
You just started. This is not when it starts.
Yes.
I think that, so I think that's a big thing there. I think on the other side is being flexible, right? So we're going through, these organizations going through financial struggles. Let's say you're an outsourcing vendor and you're committed to receiving a certain amount of volume. Well, the organization's going to have challenges. They may need to pull some back. They're going to have different things. Being a flexible partner and how you've structured that arrangement. Again, you're supposed to be there for the long haul. This is not a 2-year arrangement or 3-year, right? If you're trying to really be there for 5, 10, 15, 20 years, thinking about how you can help the organization in their real-time challenges and being flexible in your current arrangement, I think goes a long way. I think the frustration that you get out there is like, oh, we've hired a vendor for X. They keep trying to sell us Y and Z. Right? And it's so it's like, if you can stay focused on X, but then pay attention to what do they need within X that could be changing, you're probably going to get a more receptive conversation when they want to talk about why than if you try and push on it.
Well, let's make it milestone-based, performance-based. Can we arrive at the destination we already described? And even agree ahead of time. We'll expand into these areas or even look at that if we succeed in the first regards, right?
Well, and I think the more you do that, I think to realize that the more rational both sides are and the more we agree on that, it really, I've seen great partnerships out there work, and it's fantastic to see, even as a third party looking at it, saying, that's a really good, healthy relationship. That's fantastic. Or, oh, you have this issue? Go talk to them again. See if they can help you here, right? And just promoting it versus saying, oh, go call these 10 other ones and decide if you want to use them instead. And that's a lot of work. It's a lot of work for the providers. It's a lot of work on the vendor side, right? So if you're already the incumbent vendor and you can help, I think that's what you need to be doing. And if it's not you, bringing solutions to the table of saying, well, you know what, we can't do it, but here's who we might suggest you talk to.
That makes a lot of sense. So I do want to get from you how people can get in touch with Chartis, understand how to get started. But before I do that, every moment of this conversation has been driven by my questions.
Yeah.
So I just want to make sure that, if there was a question that I didn't ask that leads to a rich vein of gold in terms of the guidance that you have for health system leaders who are now facing probably the greatest challenge that health has faced so far. If you had a different question that should have been asked that I didn't ask, what is your thought about that?
Yeah, no, I mean, I think we hit on a lot of what I was hoping we would cover. I just go back to saying, I think, and you talked about early on, right? We're in an age of innovation.
Yes.
And I think we need everyone to embrace the innovation.
Yeah.
But embracing innovation doesn't mean we ignore our day-to-day responsibilities and the challenges we face today, right? And I think sometimes people conflate the two. They're like, oh, innovation means it's the future. No, innovation means today. We need to innovate today. We need to be doing it, not losing sight of the fact of what else we have on our plates. But how do you bring both together? And I think that's, if I go back to that strategy comment of laying the groundwork of what are we trying to do, where are we trying to get to, and then what problems are we solving? You kind of keep that always top of mind. You're going to address what you need to today, but you'll address what's coming down the road, in a few 5, 10, 15 years.
Okay, well, I imagine that resonated with quite a few people. Yeah. So if they found I want to make innovation what I'm doing today, how did they begin with you?
Us specifically as Chartis. I mean, I would just, you can go to our website, chartis.com. We've recently just rebranded a little bit. But, you can reach out to me. So I'm one of the leaders of our revenue cycle practice. But we cover, we do strategy work. We do financial operations. Okay. We do IT. So we cover from a provider standpoint almost all of it. And we work with we just acquired a payer practice recently too. So, you can reach out to me. My email is actually really easy. I created a nuanced one. It's pk@chartis.com. So always happy to reach out. But anyone, if you go to our landing page, any one of our senior partners and folks would be happy to talk to, anyone about any of the challenges they're facing.
PK, the scope of your vision of this industry has made this conversation really valuable to this series. I really appreciate you taking the time to talk with us.
Well, I appreciate you inviting me. Thank you.
Yeah, thank you. Right on.